Hey guys, it's Dr. Justin Marchegiani here. Hope everyone is doing phenomenal. Since daylight savings time, I cannot get my son's bedtime back. So we're still about 45 minutes behind schedule with his bedtime. So glad that we are connected. Glad you put your questions here. I look forward to diving in and helping you all out. Hope everything is going good. Make sure you subscribe, hit the thumbs up button, put your comments down below. Really want to know what your thoughts are, what new video topics. My new lighting setup has come, so I'm going to be doing some more dry erase board videos, which I'm really excited to do. So excited for that. Look for more content, feedback, and suggestions. All right, so let's dive in. What is going on? Elizabeth writes in, hey Liz, hope you're doing well. Dr. J, my boyfriend's having some issues with Rosacea and Tinea versicolor. He's listening with me right now, so we're having his attention. What can he do? Pressure is on. Well, in general, the first thing is you got to starve it from one side. So if it's kind of a chronic long-term issue, you really want to make sure you keep, a lot of the starchier carbs down at least a little bit. Maybe a serving or so of sweet potatoes or some lower sugar fruit may be okay, but you don't want to overdo it because that can definitely feed a lot of the yeast. Essentially, tinea versicolor is a yeast-based rash. That's number one. Number two, we want to address the gut. So we may use herbs like oil of oregano. So my line, we use G.Eclair 5 or G.Eclair 6 with Podiarca, or even 4, which is a lot of berberines. These are really good herbs to help knock down some of that not so good stuff in the gut. And then we may also topically hit it. We may use various antifungal soaps. I mean, I have a couple that I like. Purely Northwest, ART Naturals are good. I like Wonder Balm is like an ointment. It's like a tea tree melaleuca ointment that's really good that you can rub on there too. And then we may also use a lot of probiotics after we do a lot of the clearing herbs, especially Saccharomyces boulardii, because that definitely competes with a lot of that. But we got to get the root cause, right? Starve it, kill it internally and topically, and then crowd it out and reinoculate. Hope that helps, Liz. Kasha writes in, thanks so much for doing these Q&As. I have a candida overgrowth as well. Well, 2 candida questions in a row. And have in the last 5 months developed SIBO/SIFO. SIBO is small intestinal bacterial overgrowth. SIFO is small intestinal fungal overgrowth. Just wondering, is timing and natural antifungals important? I mean, yeah, natural antifungals are definitely helpful. I kind of mentioned a couple in Liz's question just before you. And then you definitely have to address the dietary issues. With SIBO, you may have to be more careful with FODMAPs, fermentable carbohydrates, because they may feed some of that not so good bacteria. So you really got to dial that in. And regarding the timing, typically we'll dose it up 2 to 3 times a day for sure for at least 60 days. Kasha came back and wrote, I've been taking them with breakfast, supper, intentionally including a small amount of sugar with meals. Oh, also one thing to add, when we are doing fungal killing, we will actually increase carbs above average when we're actually doing the herbals. It does kind of bait them out. It's kind of like cheese on a mousetrap, so to speak, and we can have more effectiveness with the herbs for sure. Undecanoic acid, Podiarca, yep, all those things are good. No problem. Those are all questions that I just answered, but undecanoic acid, grapefruit seed extract, Podiarca, oil of oregano are all really good. Generalized wrote in, had upper endoscopy, have gastritis, but negative on H.Pylori, still feel nausea, bloated. Slippery elm seems to help a lot. How long till the symptoms go away? Been on the autoimmune paleo for 30 days. Oh, great. That's awesome. So number one, just because you had an endoscopy, you still may have H. pylori, right? They're kind of dipping a bucket into the ocean, so to speak, and they're saying, oh, no fish came up, therefore we have 0 fish in the ocean. It's kind of like that. Maybe a little overgeneralized, but I've seen a lot of endoscopies miss things that maybe a stool test doesn't, right? When you're doing a lot of the more comprehensive stool testing, they're looking at things genetically. So they're a little bit more sensitive, which is great. And you may have other things going on too. So the first thing you got to do is go look at some of my podcasts where we talk about the 6 R's, right? Remove the bad foods, replace the enzymes, repair the gut lining and the hormones. That sets the foundation, okay? Of course, you'll work on sleep, hydration, all those good things. And then we'll figure out what the infections are so we can do that 4th R, which is remove. Remove whatever the bacterial overgrowth or fungal overgrowth or parasitic infections too. It could be other things. The fact that the slippery elm is helping, that's the 3rd R, right? That's the repair R. So slippery elm, deglycerized licorice, aloe, lots of L-glutamine, bone broth, collagen. Those things are all really, really good to help with the healing part, but we don't want to only do that 3rd R and miss everything else. Janet writes in, I have a red, slightly swollen spot on my finger at the joint that won't go away. 3 weeks now, it burns and still hot. I've soaked it, used essential oils like oil of oregano. What do I do? Could it be staph? So if it's like an infection where it's swollen, yeah, it could definitely be staph. It definitely could. I'd want to know, did you get like scratched by a cat, for instance? What was the issue? Yeah, and in worst case, if you have to do antibiotics though, I would go to urgent care and ask them to do an injection into the joint of the antibiotic. I would not, if you could, I would try to avoid taking systemic antibiotics. Just do the injection right into that joint if you can. Let the doctor give you their best take. A lot of times they just want you to go systemic, oral antibiotics. But yeah, so I want to know, did anything puncture the skin at all? Because I can't think of how anything would have gotten in there. I mean, did you get maybe a manicure where they maybe did something with your nail and the tools weren't fully sanitized, or a cat scratch? Just curious. All right, let me keep on rolling down the list here. Missy Lee writes in, says, hi, hey, Missy, hope you're doing good. What do you think of DIM? DIM is diindol methane. It's a cruciferous compound that helps with estrogen metabolism. I think it's good. You mentioned I've had blood tests and have high estrogen and low testosterone. I just took my first DIM pill like 5 minutes ago. Wow. 250 milligrams. I'm a petite woman over 30. Yeah, so that's good. I mean, I think it's good. I think you only want to make sure you get to the root underlying cause of why the estrogen is high. So like when I see patients, I'll run what's called the Dutch Complete Panel. And that's a good test because you can look at all the hormones, but you can also look at all the hormone metabolites, which is cool. So you can look at how you're metabolizing estrogen, and you can look at this 2-methoxy estrogen marker, which gives you the ability to see how you're detoxifying estrogen. So it's nice to have that methylation gauge to look at. So in general, the DIM's good. Of course, we can also do extra fibers to kind of bind it up, but we got to figure out why you're having this estrogen issue. Is it just you're estrogen dominant, progesterone's low? Are you having detoxification issues? If you're having detox issues, it's because you have more environmental stress because you're not eating organic, or you're eating out of plastics, or you're getting exposed to pesticides somehow. Or are you just not breaking down your foods and your B vitamins and your antioxidants, and then you're kind of low on the back end or the front end with those nutrients getting in? So we gotta figure that out from both sides. And I think DIM is okay in the interim, but you really want to think about it holistically. So if you're having more issues, definitely reach out to a good functional medicine doc. Sandra writes in, hey, Dr. J. Hey, Sandra, how you doing? What natural supplement can I give to my 5-year-old boy for seasonal allergies? He usually gets congested. Great question. In my line, I have one called Allerclear. Other people have them too. Basically, higher dose stinging nettle, bromelain, quercetin. Some have mine has potassium bicarbonate. Those are really good. I like them. There's also some decent homeopathics out by Highlands that are okay. You can mix them in kids' water and stuff. And then also just kidney glandular, just getting some kidney glandular. It's got a lot of DAO, which can help metabolize histamine. But I would say like my Allerclear would be a good one. Good feedback for you on that. There may have some ones out there that are chewable for kids too that are good. Agnes writes in, what's the best way to take oil of oregano? I hear it's good for many reasons. How many drops under the tongue? How often? For how long? Well, number one, if you're using a strong oil of oregano, you're going to burn your mucosa in your mouth if you take it orally. So typically in dropper form, and ideally enterically coated, so it opens up a little bit later down the track. So typically at my GI Clear 5 is an oil of oregano, and it's enterically coated, so it opens up more in the small intestine. But yeah, don't take oil of oregano down your the gullet in essential oil form like that. I can tell you, I was in Mexico one time. I got a parasite, and all I had was oil of oregano in a tincture form, and I tried it, and it was not pretty. K Gupta writes in your 6-hour program, if someone has both infections and hormones, do you repair hormones before killing? Yeah, we definitely get that initial process going. We want to get some momentum on that because hormones help with stress. They help with inflammation. They help with recovery. And if we're adding more stress on your body by doing more killing and knocking out infections, we want that essentially that reservoir built up versus depleting it, right? That's why it's important. A lot of my patients, they don't just have gut issues. They also have fatigue. They also have mood issues. They also may be tired, lethargic, right? So we got to build up the reserves, help with the ability to resist and kind of knock down inflammation before we go forward. Sarah writes in, I'm taking 4 HCl tablets and 1 bromelain, but I'm still not going to the restroom regularly. What should I do? It's a great question. So number one, I don't know what your diet is, so I'm assuming your diet's great, at least a paleo template, but you got to look at getting things dialed in with the diet, nothing raw for sure. And you got to look at your gut. Typically in the meantime, ginger and higher dose magnesium is great in the meantime. Generalized writes in, they will do a breath test for H. pylori next week. Should I request a stool test? Depends. A lot of their tests, they may not pick it up. If you have the ability, yeah, run a breath, run a stool, and then also ask them for a blood test, and not just IgG, but IgA and IgM. Run all three. See what comes back. Root cause, I took birth control pills for over 10 years. That's probably why. Yep, that's it. That'll do it. That'll definitely sludge up your, make it harder on your liver too, because it's got a lot of extra estrogens. And when it's oral, it has to go through that liver. So that can definitely put some extra stress on it for sure. Is DIM an androgen blocker? No, it's not an androgen blocker. Androgen blocker would be like Arimidex. They give that one for, well, I think it's a hormone blocker in general. But Arimidex in guys blocks estrogen for sure. The oil of oregano I bought is diluted with olive oil. Got it. Yeah, it may not be as strong though, but typically in capsule form it's better because it's going to decrease the burning. Crazy Miss Chick writes in, how much does a stool test cost to check for infections and parasites? In my online store, it's $3.99, justinhealth.com/shop. Click on the lab test category and just scroll down to the GI map cash test. All right, guys. Awesome. Any other questions? Let me know. I got some cauliflower pizza queued up. My wife is getting after it after she gets our son down. And that's what's going up tonight. Maybe a little kombucha action. I'm going to be back tomorrow morning. Excited to do a little topic. We can do a little Q&A, maybe a little topic of my choice. We'll see. I'm going to do a little homework tonight, see what's going on in the healthosphere, and I can figure out a little bit more from there. I like to wing it. Agnes writes in, how can I possibly increase ferritin? Taking iron supplement is not working. So in general, if we have low ferritin and we're taking iron, there's three major causes of low ferritin on average. Number one, you're a vegan vegetarian not eating red meat. Number two, you have severe gut malabsorption. You maybe have an irritable bowel disease, Crohn's, ulcerative colitis, just maybe really poor digestion, right? Or number three, we have an infection as well. So it could be malabsorption, and I guess malabsorption and infection are together, right? Malabsorption and infection together, vegetarian, vegan, low red meat together. And then the last one is actually hemorrhagia, so excessive menstruation. So maybe you have a lot of PMS where you bleed a lot, right? What does that mean, right? So your average female menstruation component will be about 4 to 7 days, 3 to 7 days, right? 26 to 30 days, 28-day full cycle, 3 to 7 day menstruation, typically 3 to 4-ish on the bleeding side, maybe 1 or 2 on the back end, 7 on the long side, 3 on the short end, typically. And if you're bleeding more than, let's say on your heavy days, more than 4 tampons a day, that's going to be too much bleeding and you're going to be low in iron for sure. Okay. Where are we at with this? Okay, good. Benefits of flax seeds. I mean, seeds have some decent nutrients in it. They can be harder on the gut. They may have some anti-nutrients. They do have omega-3 fatty acids. They are a 18 carbon though. They're an alpha linolenic acid. They do have to be converted to a 20 carbon eicosapentaenoic acid. If you have inflammation or insulin resistance, you won't be able to do it. Flax seeds can also be used in seed cycling. So they can be ground up and they can be used as a means of helping to metabolize estrogen too. Lakshmi writes in, Doctor, my husband is diagnosed with ankylosing spondylitis. We are trying to follow the diet, but still he has pains. And for us using IFT machine. I'm not sure what IFT is. Is it okay to use it often to manage pain? I'm not sure what that means. Maybe infrared therapy, infrared. Give me a little bit more info there. Maria writes in, hey, Maria, hope you're doing well. Bronze spotting menstrual period for 10 days now. What would be the cause? Well, typically when I see longer periods, it's almost always estrogen dominance, right? So the first thing is if we know what your test is and we see maybe higher estrogen or we see estrogen dominance in relationship to progesterone, then that's a concern, right? So of course we may use like maca, we may use, let's just say progesterone. A lot of times in my cycling women, I'll use it in a augmentation style. So I'll use it only the last half of their cycle. That's typically how we'll do that. But then we got to make sure diet, nutrition, and blood sugar are all under control. But estrogen dominance, typically we use progesterone to help. I know you had a lot of food sensitivities and a lot of like acid reflux, so those may still be an issue. I'm not sure. We should check in soon. Pink writes in, what do you think about carb cycling for an endomorph body type that weight loss? So endomorph meaning you have a hard time losing weight, I'm guessing, because ectomorph are the ones that have easier weight loss time. So I think it's good. I think it's great to do kind of a lower carb kind of keto shtick and then up the carbs a little bit at night, or kind of go lower carb for a couple of days and then come back out with a little bit higher carbs. I think that's totally fine. That's good. Is it okay to have a fungal infection if your candida or fungal overgrowth is in your gut? Why? Well, you don't want an overgrowth in your gut. You definitely don't. Why? Because candida produces byproducts called acetaldehyde, which are stressful on the liver. They can also ferment alcohol. There's a condition called autobrewery syndrome where in the literature, people have been pulled over drunk because of the alcohol in their gut that's fermented by their yeast, not from them drinking it, but from them literally having their own auto brewery in their gut. So not good, definitely a stressor. Eat up a lot of nutrients, cause you to crave a whole bunch of sweets and junk. Definitely not good. And it's stressor on your immune system, right? People that have like compromised immune system, like cancer or AIDS. I mean, people die of this stuff, when your immune system's really compromised. So we don't want any immune stressors for sure. Missy Lee writes in, restate autocorrect messed me up. I've tried everything for leaky gut and I have food sensitivities to dairy, eggs, wheat. I'm a vegan, always bloated. There's a 6-step plan. Please repeat. Yeah. So I mentioned it earlier. So I would just say, go to my website, justinhealth.com, and just type in either 5 steps or 6 steps to gut healing. I added the 6th step because the 6th step is retesting. And that's important because people that have chronic gut issues, we retest and we find out that they have a newer infection. And sometimes people have infections that are burrowed up into their gut lining. And when we retest, new ones come up. Sometimes people have partners, or they may, let's just say they're not in a relationship, but they may play in the field and they're catching stuff and hot potatoing stuff back and forth. Who knows? Things can happen, right? Even things like H.Pylori, right? If you're sharing silverware or let's say a cup, that could even be spread via saliva, like non-sexual contact. So sometimes that can even happen too. Lakshmi writes in, TENS machine, transcutaneous electrical nerve stimulator used by an electrophysiotherapist. Okay. Yep, I'm familiar with that. Yeah, you got to get to the root cause though. I have no problem with using a TENS. I mean, it can be helpful for helping with inflammation, but you got to get to the root cause. Your husband's going to need to work with a good functional medicine doc to help this. It's just too complex. Holly writes in, can you talk about hernias and preventing them after having one recovered? So what kind of hernia? Like hiatal hernia, where like the esophagus goes above the diaphragm? Or are we talking like a hernia or like that, where your abdominal wall separates and like organs come out? That's the really important thing. So I would say first thing, if it's diaphragm, get the inflammation under control in your stomach. Typically, make sure there's not H. pylori. Make sure you can digest your food. If it's abdominal wall stuff, then you just got to really make sure you have good connective tissue support, good collagen, and you keep inflammation down. And of course, you have good lifting techniques. So you're activating your core, so to speak, when you're lifting, whether it's abdominal bracing or hollowing. Typically, bracing is the new thing. You're welcome, Missy. Let me know what you think. I'll be back tomorrow if you have more questions. Dennis writes in, what causes otitis externa? Otitis externa is your external ear infection. A lot of times you're going to see that with usually, I think you're going to get that from like swimming and stuff, because that's coming outside in. Typically like otitis media, you'll get that inside out. A lot of times you'll get that through like sinus infection. Then it goes through then it will go through the eustachian tube into the ear that way. So you can get it inside, typically through the sinus that way. Mucus and gluten, dairy, a lot of times will cause more of that to go that direction. And then typically swimmer's ear will be otitis externa. I had that a ridiculous amount of times growing up. Ridiculous. All right. And the solution for that, by the way, 50-50, 3%, 50-50, 3% hydrogen peroxide, cut with water, put in each ear multiple times a day. That helps. But the diet change really helps too. All right, cool. What are the questions? Crazy writes in, what do you recommend for detoxifying heavy metals? It's complex. Depends on the metals. We may use DMPS or DMSA. We may use ALA. We may use some binders and modified citrus pectin, glutathione, activated charcoal. So it just depends what kind of metals too. But I have a product called Heavy Metal Clear that has some of that in there. But we may also cycle and do like an Andy Cutler protocol too. Sarah writes in, what brand of digestive enzymes do you recommend? Well, of course, I'm going to recommend my own enzyme synergy, but you want something that's got a combination of proteolytic, means protein digestive enzymes. You want like carbohydrate-based enzymes like amylytic that break down carbs, like various lactase or amylase or there's a bunch. If you look at mine, I have like 6 or 7 I put in there. There's like 2 or 3 proteolytic ones, and there's one fat one, which is lipase. So I like that. But there's other good companies that are out there that produce enzymes that are really good too. But you want proteolytic, lipolytic, and then carbohydrate based, which are a lot of times amylytic. And how do you know it's an enzyme? It ends in ASE. Yep, hiatal hernia. So I already answered that. So get the stomach fixed. Hope that helps. Agnes writes in, back to my ferreting question, menstrual cycle's fine. I'm not a vegetarian. Recently had a stool test and came back okay, no parasites. I'm drinking ACV for gut health. What else should I test? Well, I would say I don't know what stool test you got. I didn't see your iron panel, so I'd have to really see it to know if it really is an issue or not. What are you basing that off of? Are you basing it off of ferritin, iron saturation, TIBC, UIBC? Do you have low RBC, hematocrit, hemoglobin? Like, because something else is going on here, and there's probably a malabsorption that you may not be aware of. I'd have to ask you like 10 more questions to dig in, but there's something else going on probably with your gut. What brand of HCl do you recommend? My line, HCl Supreme. I mean, just a really good clean HCl with pepsin is going to be fine. Almost every company makes it. You just want to make sure it's clean. That's all. Luana writes in, does a banana do well for heart health? Well, I mean, bananas have a lot of potassium, but guess what? Avocados have twice the amount of potassium. You would never know that. You ask anyone, right? What plant product has the most potassium? Everyone's going to say banana, but avocados twice as much. So potassium is great for the heart, right? But I mean, there's also a lot of carbs. So if you're insulin resistant, it wouldn't be that great. If you can deal with the carbs, then it'd be okay. Citadel writes in, Dr. J, would I be able to safely use serum-derived bovine immunoglobulins during breastfeeding? What about colostrum? And what would be your rationale? I mean, I think you would be able to. I mean, here's the deal. Anytime it comes to like pregnant women and infants, like no one does studies on this because who's going to offer up their kid as a sacrificial lamb, right? So everyone kind of has CYA label, like not to take if you're pregnant, not to take if you're breastfeeding. So a lot of these things come with that label because no one tests for it and no one will, right? If you're a good mom, you would never do that, right? So in general, I would say it'd probably be okay, but I'll smack that same CYA disclaimer on it as well. It would be to help heal my gut and calm food sensitivities. Yeah, good. So I think you probably could do it, but I just, see your own doctor on that one. But definitely healing your gut, I would definitely focus on collagen, L-glutamine. Those are all good things that you could do. You could definitely sip on ginger. Turmeric's really good too. Turmeric you could probably do as well. My wife did it. I recommended it. It's also a galactagogue, so it helps increase your milk supply. So I like that. Agnes writes in, do you work with patients from out of the States? What do you charge? So justinhealth.com/FAQ, everything is there. And yes, patients all over the world. I get around all over. I mean, today I saw a bunch of patients in the US, patient in Australia, patients in the UK, all in just one day. Yep, no studies. That's the thing. But I mean, they're like recommending the flu vaccine now to kids, to moms that are pregnant. And I don't even think there's any studies on that. Like there's not even any trials on flu vaccines being given to pregnant women, but that's being recommended. So, I mean, I don't know how they could do that, but it is what it is. So in general, any other topics you guys want to hit, let me know. I'll be back tomorrow at 9:30 a.m. CST time. Spencer, thanks for chiming in. I appreciate it. And outside of that, a couple other things that are popping up. My book, The Thyroid Reset, will be out very soon. It's almost there. I'm getting the cover redone. If you sign up for the Thyroid Reset Summit, you'll get the first 80 pages of it, the first 3 or 4 chapters. So it's really good. I will be coming out with a thyroid masterclass as well. So if you guys want to dive in deeper and really engage, and let's say you're not ready to commit to a functional medicine doc, this could be good for you to get some more information and help empower your health. So you guys have a phenomenal night. I'm going to go have a cauliflower pizza. I'm really excited about that. Maybe a little kombucha action. We'll see. I'll be back tomorrow morning. You guys have a phenomenal night and be well. Take care, guys. Bye.